Healthcare, hospitalization costs. We're continuing our microanalysis of the healthcare industry. And we are going to carry over some summarized data points from other segments, but we're not going to take the time to go over them in detail. But it's worth us understanding that individually, we can, in fact, retain our wealth and power to do good. That is, we don't have to participate in these institutional-based coverage solutions, that we can keep that wealth to ourselves. And we don't have to relinquish the power of choice with regards to our health care, but we can retain that power unto ourselves. I mean, not only is it reasonable to think that as we do so, the cost of health care will come down to reasonable, sustainable levels, but it is feasible for us to believe that we can do so now. Now, we understand that 1 in 10 will visit the hospital each year. That means of all hospitalizations that occur each year, they occur 1 out of every 10 of us. Now, as we look at those numbers, we see that 5.7% of those hospitalizations are uninsured stays. That means that over 94% of hospitalizations are from the insured. When we look at the cost, we see that those uninsured stays are running about $19,400, while the insured stays are running about $24,000. The difference? Well, it's length of time. The uninsured is staying about 3.9 days on average, while the insured is staying about 4.6 days. Now, the data doesn't specifically describe why, but I would just like to give an illustration as to one reason this could be occurring. I mean, think about it. If you received a few $100 gift certificate to a very nice restaurant, and you took that gift certificate to go eat there, I mean, you're not going to be looking at the prices for individual items on the menu. You're going to order the soup, you're going to order the salad, you're going to get an appetizer, you're going to get the entree, you're going to get dessert, and you're going to lay that gift certificate down and not even think about it. And then that waiter's going to come over and he's going to see that gift certificate, and he's not going to bring you the house wine. He's going to bring you the best wine. Maybe he'll even bring you out a bottle of champagne. And that's what happens with institutionalized coverage-based solutions. No single individual is responsible for the wealth that was created in that pool. Therefore, we'll spend whatever, irregardless of the cost. Now, we understand that the reasonable cost for hospitalization should be 2/3 less than what we're currently paying. I mean, room and board for 5 days should come out to about $2,000. Additional administration costs should be $500 per patient. Even factoring in the cost of surgery, that's $1,600, and nursing care at $750, and then the testing, 20 hours of testing, which takes place under the same roof, using the same electricity and air conditioning and linens that we've already paid for in our room and board, should be about $2,000. Then there's the added equipment cost. The heart-lung machine running $15 to $20K, and machines such as those, that should come out to about $300 per individual. And then we add all that up and add 10% for the cost of pharmaceuticals, which would be about $715 per individual. We see that the reasonable cost for hospitalization should be $7,865 per patient. But that's not what we're paying today. And some would point to that 5.7% of all hospital stays by the uninsured as the reason for the increase in the cost. That's just not true. When you factor that cost into the $24,000 already being paid, it comes out to an additional $1,104 per patient. That brings the total cost to $25,104, or just an additional 4.4% over what is currently being paid by the insured. We have to understand that of all those hospitalizations, 27% are due to those aged 65 and older. And of those aged 65 and older, 94.9% are being hospitalized for heart complications. In addition to that, there are 11% of hospitalizations which are due to childbirth. So that means of the 1 in 10 who will visit the hospital each year, 36% of those hospitalizations are due to childbirth and heart issues from those older than age 65. This means 1 in 16 will visit the hospital outside of the normal processes associated with life and death. Now, when we take that pool of 16 members and we break it out to the cost of hospitalization in a privatized manner, that means each person would pay $1,568.75 per year. Knowing that outside of hospitalization for natural processes such as childbirth and aging, our chance of hospitalization is less than 6.25%. That's a 6.25% chance of hospitalization outside of normal human events. This means in a pool of 16 members, each member would need to contribute $1,568.75 per year, or $174 per month. This would cover that $25,104 per hospitalization. But what about those aged 65 and older? Well, you can live as long as your strength allows and you can pay for it. I mean, Scripture bears this out, that we should take care of our parents, for they took care of us. And the real news is that we can pay for it individually. We can retain our wealth and power outside of coverage-based or governmental institutions. When we consider that those individuals who are 65 and older, those at 27%, and we understand that the cost of hospitalization is $24,000 on average, and there being a total U.S. population of individuals between 18 and 24 of 248 million, then all we do is we take that number, because each one of those had a parent, and we divide it by the total cost for hospitalization of those aged 65 and older, and we get a yearly cost in addition to what we were paying of $1,031. That's an additional cost to each individual between ages 18 and 64 of $86 per month. So again, retaining our wealth and power to ourselves to do good in a private pool of 16 members between the ages of 18 and 64 who were paying $1,568.75 or $174 per month would now pay an additional $1,031 per year, or $86 per month, to cover those individuals 65 and older who require hospitalization each year. This brings the total cost of the individual to $2,599.75, or $216.65 per month, to insure a pool of 16 members between the ages of 18 to 64 at today's cost of hospitalization. And that includes care for those ages 65 and older, and of course it covers those who are unable to pay. This is $2,100 less per year than the current average of $4,700 for single payers, and $175 less per month than the current average of $391 for those same single payers. Now, what about those ages 0 to 17? Those who are unable to contribute. They make up 17.1% of all hospitalizations. But we have to realize, of that 17%, 11% of those are due to childbirth, which is a natural process. And as we discussed in the childbirth segments, individuals can keep their wealth outside of corporate-based coverage solutions. There is really no need to insure natural events such as childbirth. So those individuals or families who are responsible for that less than 7% in the age range of 0 to 17 who require hospitalization outside of the childbirth processes, they would need to contribute an additional $448 per year, or $38 a month. See, all we do is we take those 0 to 17, who are part of the hospitalizations each year, and we realize that only 6.1% of those are occurring outside of childbirth. And when we factor in the total number of families in the U.S., which is 64 million, for the cost of hospitalization for that 6.1%, it comes out to $896 per family, or $75 per month per family, which breaks down to $38 per month for each individual who is responsible for somebody in the ages of 0 to 17 outside of childbirth. So in closing, individuals having dependent care, those ages of 0 to 17 outside of childbirth, which are now spending $2,599, would then have to spend an additional $448 for each dependent they were in care of. So if a single payer was in care of one dependent, they would spend an additional $448, which would bring them to $3,047 per year, which is still $1,652 less than the current average of $4,700 being paid by single individuals with no dependents. That would come to $254 per month, which is $138 less per month than the current $392 being spent by single payers with no dependents. For families that had dependents, they would be spending $5,199. That's $2,599 times 2, because there's 2 who are heads of house. And then they would be spending that $448 for each dependent that they were responsible for. And as the average family is responsible for 2 dependents, that would be $896, bringing their total cost to $6,095 per year, which is $3,905 less than the current average being spent by families, which is $10,000. So this comes out to $508 per month, which is $325 less per month than the current average of $833 being spent by families with an average of 2 dependent cares. End result over time: reasonable, sustainable health coverage while retaining the power of the individual to do good. God bless.